Mr. Vidal, you have 6 minutes.
Thank you, Mr. Chair, and thank you, Minister, for being here with us again today and talking about some of these very important issues. Minister, as you talked about in your comments, and as I think you're fully aware of kind of my riding, you were out in Saskatchewan here a few weeks ago, but people travel, great distances to access medical services, to attend appointments, and you talked about medical travel in your comments. There's a lot of people that rely on that in my riding in very significant ways because of the great distances. They're often hours and hours away from these appointments. And one of the things I've run into in the last few weeks is on multiple occasions I've heard from people that operate the medical taxi companies how they're struggling with the increased costs. I mean, obviously fuel prices and that gets exaggerated, obviously, in a remote location and distances. And I see my colleague from the block nodding as we shared some common questions today in question period about remoteness. But these are a lifeline for many of these people. And if the medical taxi companies can't survive the increasing costs, that creates a whole new issue for us, right? So we heard from the vice chief of the FSAN the other day about the ongoing reviews. You referenced them today as well. I'm just curious in that process if there's anything going on in the context of this medical taxi service. I mean, is there some review that creates a fee that adjusts with fuel prices or anything that would help these places survive, these businesses survive?
Well, thank you very much, MP Vidal, and I'll just generally say that inflation is top of mind right now for Indigenous Services Canada, not just in this aspect of medical care, but certainly in the aspect of infrastructure development and many other aspects that the department supports. So maybe I can turn to Val or Scott to answer specifically the question.
I'll start, and then I'll invite Scott to add briefly. So we have, to reimburse mileage rates, we use the National Joint Council Commuting Assistance, which actually does take into account cost drivers such as inflation. We are in the process now of doing a review of the medical transportation benefit with the Assembly of First Nations. We made a change last year, for example, of increasing by 25% meal and accommodation rates in response to calls for the fact that we hadn't sufficiently increased our rates for a number of years. So I'll just invite Scott to speak to anything that's more specific to the medical taxi issue.
And I'm just going to, if you can be brief, that's great. I've got such limited time and I have lots of questions.
I would have nothing to add then.
Okay, that was brief. Thank you. Minister, another thing you talked a lot about, and I think you're well aware of the problems in my writing is the idea of mental health, the challenge of mental health. I mean, when I was first elected in 2019, one of the first things I dealt with was a crisis at one of the First Nations, very close to my community. And one of the things that I hear on the ground when I talk to the leaders in my communities is that they're looking for something kind of in a, if I could phrase it as kind of a whole family approach rather than an individual approach. I wonder if you could, and again, just because my time is so limited, if you could briefly just, is that going on through the non-insured health benefits? Is there some openness to some new ideas? Kind of where are we at with that?
Yeah, again, thank you for using that example, actually, because there are communities in my riding that are exactly doing that kind of innovation, recognizing that substance use and mental health issues are actually a systemic kind of a community problem, not so much an individual problem. Certainly fits well with an Indigenous lens as well, that a holistic lens of community wellness. And so, yes, there is flexibility for programs that can be delivered that are designed by Indigenous people. I referenced Choose Life in my remarks. This is a youth suicide prevention program that was designed by and delivered by community. And even within the flexibility of that design, individual communities can adapt it to how they need. So, yes, there is that flexibility in the funding to communities to provide family, social group, all kinds of alternative approaches.
Thank you. And Mr. Chair, I'm sorry, I didn't start my clock today, so you're going to cut me off at some point. I don't know where I'm at in my questions today. Sorry.
You have a minute and a half.
Thank you. I'll be very quick with my next question. Minister, you actually referred to this a little bit already, but I want to more directly ask maybe, so if there was an organization that had some kind of innovative, culturally sensitive ideas and they wanted to do a pilot project, they wanted to get some support for some of those ideas that not only just a community-based thing, a family-based thing, but also in a lot of our areas, we have to do them regionally as well because we can't be everywhere, right? So if there's ideas like that they want to bring forward, what would that process be? How hard is that to actually kind of get the department to do some out-of-the-box thinking on some things they've never done before, maybe is the way I would say that.
Well, I'll answer generally and turn to Val, but it depends on where that community group is. So, for example, if it's in an urban setting, it can be a bit more challenging. But if it's on a First Nations community or in a community, a regional community, tribal council, for example, I think there's quite a bit of flexibility by the department to be able to work quickly on a conceptual idea and then take it from that conceptual idea to actually be able to implement it on the ground. Val, do you want to add?
I would just say exactly that. And wherever possible, we're finding horizontal ways to work across sectors so that we can be more flexible in our policy authorities and our funding envelopes.
Thank you very much,
Thank you,
Mr. Vidal.